Narcissistic personality disorder. Have you ever met someone who believes they are the most important person in every room? Not confident, something deeper, something emptier. That is narcissistic personality disorder. On the surface, they seem powerful, charming even. They demand admiration. They exaggerate their achievements. They expect special treatment everywhere, from everyone. But underneath that confidence is something fragile. A single criticism can shatter them. Not because they are sensitive, because their entire identity depends on being seen as superior. Take that away, and there is nothing left. They struggle to feel empathy, not because they choose to be cruel, but because other people's emotions simply do not register the same way. You are not a person to them. You are a mirror. And if you stop reflecting what they want to see, you become the enemy. Borderline personality disorder. Now imagine the opposite problem. Not too little emotion, too much. Borderline personality disorder means your emotions are extreme, fast, and overwhelming. You do not just feel sad, you feel destroyed. You do not just feel happy, you feel euphoric. And the switch between the two can happen in minutes. Relationships are the hardest part. You attach deeply, desperately. You idolize someone. And then one small comment makes you feel completely abandoned. So you push them away before they can leave. Then you panic because they are gone. People with BPD often describe feeling empty inside, like there is a hole that nothing can fill. Not love, not success, not attention. The emotional pain is so intense that some turn to self-harm just to feel something different. This is not being dramatic. This is a nervous system that cannot regulate itself. Every emotion arrives at full volume, with no way to turn it down. Antisocial personality disorder. You have probably heard the word psychopath. The clinical term is antisocial personality disorder. These are people who can lie to your face and feel nothing. They break rules, manipulate others, and take what they want without guilt, shame, or remorse. But here is the part most people get wrong. They are not all violent criminals. Many of them are highly functional. They hold jobs. They have families. They blend in perfectly. That is what makes them so effective. Their brain processes risk differently. Where you feel fear or hesitation, they feel opportunity. Where you feel guilt after hurting someone, they feel nothing. Not anger, not pleasure, just nothing. The pattern usually starts in childhood. Lying, cruelty to animals, breaking rules with no concern for consequences. By adulthood, it is hardwired. And the most unsettling part? They often know exactly what they are doing. They simply do not care. Avoidant personality disorder. Now imagine being so terrified of rejection that you stop trying altogether. Avoidant personality disorder is not shyness. It is a deep, constant belief that you are not good enough for anyone. You want connection. You crave it. But the fear of being judged, criticized, or humiliated is so overwhelming that you avoid people entirely. You turn down job opportunities because you might fail. You avoid friendships because they might reject you. You stay silent in conversations because you might say something stupid. The painful irony? The thing you want most, acceptance, is the thing you will never let yourself have. Because getting close to someone means they might see the real you. And you are convinced the real you is not enough. From the outside, it looks like someone who just prefers to be alone. From the inside, it is a prison. Histrionic personality disorder. What if you could not survive without attention? Histrionic personality disorder is a constant, desperate need to be noticed. Not liked, noticed. Every room must revolve around you. Every conversation must be about you. If the spotlight moves to someone else, it feels like you are disappearing. People with this disorder often use their appearance, emotions, or behavior to draw attention. They may be overly dramatic, sexually provocative, or emotionally exaggerated. Not because they are shallow, but because without external validation, they feel invisible. Their emotions change rapidly and seem exaggerated. But to them, they are completely real. They may call someone their best friend after meeting them once. They may feel devastated by a minor disagreement. The core fear is simple. If no one is looking at me, do I even exist? Obsessive-Compulsive Personality Disorder. This one is tricky because it sounds like OCD, but it is not. Obsessive-Compulsive Personality Disorder, OCPD, is not about intrusive thoughts or rituals. It is about control, absolute, rigid, unbreakable control over everything. People with OCPD are perfectionists, but not the productive kind. They are so obsessed with rules, order, and doing things the right way that they often cannot finish anything, because nothing is ever good enough. They make lists for their lists. They cannot delegate because no one else will do it correctly. Relationships suffer because flexibility feels like chaos, and chaos is unacceptable. The difference from OCD? People with OCD know their thoughts are irrational and want them to stop. People with OCPD believe they are right. They do not see a problem. Everyone else is the problem. I'm Brain Typo. See you in the next update.